Hey guys, so today I'm actually going to talk about my surgical experience gallbladder edition. No, I'm just kidding. Yeah, but today actually I'm going to talk about my gallbladder experience. So first things first, I did have surgery on September 12th. I had a tube for 5 days and then it came out and I'm okay. But I will start from my symptoms beforehand. Now, I'm going to show some pictures and show you guys some of my scars and stuff and a video. If that's a little too graphic for you or you know that's not going to be appropriate for you to watch, please. Before I got this out, past 2 years, I've actually been in and out of the hospital. Some of you guys know that. My friends have gone with me. My boyfriend's gone with me, you know, like it's just been a really rough 2 years for me. I had a nausea problem and like where I get nauseous like every single day, whether I eat, whether I didn't eat. I just get really, really nauseous, and I thought that I was getting nauseous because I wasn't eating. I thought I was getting nauseous because I ate too much, and it just became like natural for me to be nauseous at least all day, every day. I would wake up, if I woke up nauseous, I'd be nauseous all day long. If I wasn't nauseous in the morning, I'd be nauseous at night, and the thing is I would never throw up, ever. I would never get sick, I'd never throw up, but I'd just be seriously, completely nauseous. Now, I can handle pain. I can handle a good amount of pain. I can handle being sick. I cannot handle nausea. I feel like nausea just kills me. And luckily I haven't had a job for a year. Last August till like now, I didn't have a job. So luckily I was just not really doing anything. I was kind of going to school and kind of watching this girl for a little bit, and luckily that's it, because this would have just killed me. I was literally sick all the time. I was taking Pepto-Bismol, wasn't working, taking these nausea pills, and my body was literally building up an immunity to these nausea pills, and I took like the highest nausea pills you could possibly find. They thought it was my birth control, so they kept switching me on different kinds of pills and whatever, because I have cysts, so I have to be on birth control to regulate that, so just so clear that up for you guys. But they had to keep changing it. I bet I took like 12 different kinds of birth control pills, and it kept making me more and more sick, and they were like, well, we're going to take her off of this, but if you take me off of it, I would get a cyst. So either way, I'd end up in the hospital, and I kept having a lot of pain in my right side and like up under my ribs, just so much pain, and I had like no idea what it was, and we had no idea what it was. And then finally I want to say in the summer at some point, we got a HIDA scan. And it was just a scan that you go in, they give you an IV, you lay there, you look at a screen, finally, and they're like, oh, you know what? We think it's her gallbladder. So got the HIDA scan, very uncomfortable scan, but you know, something you gotta do. Came out of it, they're like, you have a sluggish gallbladder, which most people, when they have an overactive gallbladder, every time they eat, they just immediately throw up, they throw up, they're sick, they know it's their gallbladder. Mine was sluggish, so it wasn't acting, it wasn't doing like really anything, it was just sitting there becoming diseased. So I had to go get it out. Now, I am the kind of person that's like, ask anybody, and I'm sure my friends, if they watch this, will comment on how bad I am with needles. A baby. I swear to God, I'm a baby. Like, I scream, I cry, I'm not good with needles. And my boyfriend and my mom went with me to well, everyone went with me. My boyfriend and my mom actually went with me to the pre-op, and they couldn't go in the room with me, and I was like, okay, what is this? And I had to get this IV by myself, and it was so scary. I got it, you can't see it anymore, but I got it right there, and she gave me Novocaine, and I was like, that hurt so bad, my skin like puffed up, and then she put an IV through like the Novocaine, didn't feel it at all, and I'm like, oh, I just got my first IV by myself, which you guys saw on Instagram, and I'll post pictures. But and then she comes back in, oh, we have to give you a shot in the thigh. I'm like, no thanks. But yeah, I actually still have a bruise. I bruise very easily, so when I get shots and stuff, I actually bruise for like a really long time. So I still have a bruise from this this shot that she had to give me, and it was for to prevent blood clots and whatever from the procedure. So when I don't really know where to start. Okay, so the anesthesia guy came in, and I was all ready. My mom and my boyfriend were down there. I was like all ready for surgery, had this cute little hat on, and he comes in and he's like, all right, this is what's going to happen. I'm going to give you a relaxing medication, and then you're going to go into the OR room, and then they're going to give you anesthesia. Now, depending on the person, most people can't go past the relaxing medication. That usually just knocks them out. Well, it like makes it so they don't, they usually, as soon as you give them the relaxing medication, you literally don't remember anything. Like when I got my tonsils out, I thought that was the anesthesia, and like when they gave it to me, I was out within like 10 seconds. I was out. But this one, I actually was able to kind of retain memory for about 2 minutes. I'll post a video in a few seconds, but yeah, so that was really, really funny. I don't remember what I said to my boyfriend or anything, but the video is going to be put up right now.
You're not going to even know it.
The idea is that if I tell you that it might hurt, and it hurts, you don't get as surprised if I don't say anything. And then all of a sudden you say, oh my God.
Sore. It's cold and sore. Yeah, it's not a big deal though.
I'm going to walk away and give it a minute for it to work. And I'll continue.
Okay. You're good. You're fine. You're fine. How long is the surgery going to take? 12, 15, 25 hours maybe. Who knows? Oh, thank you.
Medications. So we'll see. It's, you know, they're still kind of related medications.
Oh, that's
Hopefully it'll be better
Oh, that'll
for
be,
you.
that'll
All
be
right.
fine, I'm sure.
Most
now,
people
can
don't
we,
have a lot of
now when
pain.
do we can, I can just go.
Yeah, while she's having surgery.
Okay. I wanted to see the OR room too. Guess that's not going to happen.
You will, you just won't remember it. Probably. Some people do, but
Yeah, I love you.
I love you.
Or the red M&Ms.
More than red ones? What about blue ones?
Do they make blue ones?
Mm-hmm.
This is what we should take every night to fall asleep. You think so? I think so.
It's getting a little longer than I thought she would.
I know, me too. But she's gonna get loopy soon enough. I am loopy.
She's already. She was sitting there going.
Take it all off? Are they taking all of it off?
Mm-hmm.
That's raw.
Where was the worried person who was here a few minutes ago?
Yeah, I don't know. We replaced her.
This, I don't think this leg even hurts from the shot. Because that's not where you got those shots.
And then, so I wanted to try to fight really hard, and I remember fighting, and I was like, I have to stay awake, I have to stay awake, keep talking to me. So the anesthesia guy's like pushing me to the OR room, and I'm in my little bed, and I'm just like, keep talking to me, keep talking to me. And he's like, why? I'm like, I want to see if this room looks like Grey's Anatomy. I really wanted to see if this operating room looked like Grey's Anatomy. And he was like, okay, you know, what's your middle name? When's your birthday? What do you want for your birthday? What are you gonna do for your birthday? 'Cause my birthday is coming up. So he's like, how long have you and your boyfriend been together? Are you going to school? Are you working? He was like literally trying to ask me questions. Who's your favorite Grey's Anatomy character? And I was like, Owen. Owen. If you don't know who that is, he's a redhead hottie. You should go look him up. Owen Hunt, Grey's Anatomy. He is so hot. But I get to the room and I'm like, oh, I remember it just looked really, really clean, and it smelled really strong, like cleaning products. And I'm like, oh, this is it? I was so disappointed. I was like, okay, I can go to sleep now. But I was like, oh, I've already been fighting this medication, so it wasn't working. So I moved myself to the operating table, and I don't remember anything after that. I remember holding one of the nurse's hand, and I'm like, I'm so scared. And she's like, it's okay, you're gonna be fine, you'll be in and out, you'll be good. And then I passed out. But I remember like holding her hand and passing out. And when I woke up, before, whenever I'd wake up from morphine or anything, I'd be so loopy. Let me I'm not trying, I don't want to scare you, because I do know I have subscribers that are going to get this out, but it's different for everybody. Because everybody, it's like, oh, do your shoulders hurt? Do your shoulders hurt? I'm like, no, my shoulders don't hurt at all. But people said because when you have gallbladder surgery, you can, depending on how bad it is, usually they do it laparoscopically, which is what they did for me. I'll insert pictures of my scars the day, and then I'll insert pictures of my scars today, after this whole video thing. But usually they just do 3 or 4 little incisions and you're good to go. But if it's like really severe, they gotta get it out, they will cut you completely like open and get it out. They did not cut me completely open, but when they do, I do know that it raises, the air will rise to your shoulders, and it will hurt so bad you will feel like you're dying. Swear to God. I had the air in my stomach, like in my abdomen, and I was like, I remember waking up like crying like, ow, it hurts, it hurts, it hurts, it hurts. And they're like, what hurts? I'm like, my stomach, the air, it hurts, it hurts. And they kept trying to give me morphine and IV, and I had a whole bunch of like ibuprofen being pumped into me through this IV, and nothing was touching the air. And I was literally like, you need to get this air out of me. And they were like, well, you need to walk around. And I was like, no, I'm not gonna stand up and walk. So they gave me juice, like apple juice, and I drank that, and it kind of like helped move stuff around in my stomach. And then they gave me an ice pack, and that helped a lot. And they gave me a heating pack, and the heating pack is the only thing that took the air pain away. So it was the only thing that actually felt like my muscles were working, and it wasn't like, it felt like the air was like coming out slowly. But that was the most painful thing I've ever felt, was the air. So not fun. But I stayed in post-op, I think, for like 4 hours, and then I got to go home. So, but I did have a tube, and a lot of my friends that they say did not have a tube. Family, friends, whoever I've talked to have not had a tube, but it depends on your doctor or whatever. Mine was one of the best in the country, so I'm very, very happy that I got to have him. But he just does it for a precaution, because if the drainage from your gallbladder isn't leaking out in a tube, then it's going somewhere in your body. And that's what he explained to me. He's like, you don't have to have this, but this is how I work. I really suggest this. I was like, whatever you think is good. And I definitely think that I definitely benefited from it, because I didn't have any nausea from the drainage being inside me. I don't have to worry about any infections. They don't have to go back in and look and make sure everything's okay. It all drained out. So that was really, really good. When I got the tube out, just gonna say this now, when I got the tube out, I don't remember if it was bad or good. I don't remember if it was painful or just not right, because it literally, she's like, all right, she unstitched the stitches that kind of hurt, and she was like, all right, take a deep breath. I was laying down, she's like, take a deep breath. I was like, okay. Took a deep breath. She's like, when you let out, I'm gonna pull it, so take a deep breath. And then I took a deep breath, let it out, and she ripped this tube out, and I was like, oh my god. I was like ah, like I screamed a little bit, and I don't remember anything after that. Like, I swear to god, the next 10 seconds or so, just completely black. They thought I was gonna pass out. My mom was like crying for me. I started to cry, and then I stopped and started laughing, and I started to cry again, and I started to laugh again, and then I like came back, and I was like, okay, I'm good. My mom, everyone's like, oh my god, we thought we were gonna lose, or like we thought she was gonna pass out, and I was like, no, I'm good. It definitely felt weird that it literally felt like someone was ripping something from one side of my stomach to the other, but it was only in like a little bit. But literally try having a hole in your body and having someone like rip a tube through it. It feels as good as it sounds. But until I got the tube out, I slept on my back, which was really uncomfortable for me. And my shoulders were hurting then, and my neck was hurting, and I was like completely laying flat on my bed. I could not move at all. My boyfriend stayed with me for like about 3 days or so, and then he'd like go to work, come back, go to work, come back. But literally I didn't sleep very well the first 5 days. But after I got the tube out, I slept a little better, because the day I got my tube out, and the next day I went to an interview. So I like really didn't have time to rest and recuperate. I only had the 5 days to really rest, because then I had my interview, and then I got called for the job. So I was like, oh my gosh, then I had orientation, then I started working. So I kind of have to heal at a faster pace than most people do. But really you're supposed to be down for 2 to 3 weeks when you have this, but that wasn't an option for me. I literally got home from the hospital and ate chicken broth. I had sat down, had dinner with my family, just had chicken broth and apple juice and water and Powerade to keep myself hydrated. Literally didn't really eat much of anything, but I eat bagels now. Bagels and yogurt are pretty much my full diet. I had actually a full dinner last night at my friend's house that was really, really good, but eating a full meal isn't exactly a choice I have right now. But really I just can't eat anything fatty. I can't eat anything salty, nothing really high in sugar, none of that stuff, like cake, no butter, limited cream cheese, no sour cream, no whipped cream, no regular ice cream, no dairy products. Now, no dairy products is huge, except for like Greek yogurt doesn't bother me, and Greek frozen yogurt doesn't bother me, and regular froyo doesn't bother me, but like heavy ice cream and all that, so that's why you see on my Instagram I'm constantly eating Greek yogurt and froyo. So good, but I just have to be super careful for about 3 or 4 months, and then I can go back to my regular diet and just be careful, but probably won't because nothing really gross sounds appetizing to me anymore. It's kind of nice, but hey guys, so it's actually been about a week since I have recorded this, and I'm editing it now, and I'm thinking of some things that I forgot about. Yeah, it's been a week. I have to be like super careful like what I do at work because I actually haven't really had time to recover, so I'm kind of recovering at a slower pace. I'm gonna show you my scars right now, but I just want to say I'm having a lot of belly button pain, which is where they put the camera. I didn't even tell you guys where they took it out. Oh my god. They put the camera in through my belly button and they took it out like right here, and then I had the tube right on my side, so that's that. I'm having a lot of belly button pain the past couple days. I think it's just as it's bruising and, you know, healing and whatever. Yeah, and I'm in the video I said I wasn't eating full meals. I'm not. I'm eating meals, but they're pretty small portions, and then like I'll eat it. I'll be so full a half hour later I can go back to it and eat a little bit more. I also got sick recently, which is really bad. When you first get surgery and you come out of surgery, if you get sick, that could be really dangerous. I almost got post-op pneumonia, which is basically like pneumonia but worse because I have no immunity right now. Like I have no immune system at all. And me being at Aeropostale and working, it's very public place, and you just get sick from all these people that come in hacking, coughing, whatever, you know, you're touching their clothes, grabbing their credit card, you're like talking really close to them and everything. So yeah, so I hope that answered most of your questions. I don't really know what else you have questions on. If you do, leave them below and I'll message you and address them for you. But if you have any other questions, let me know. And other than that, I have pictures and stuff, so enjoy!
Medicine goes here,
Okay.
and then it hurts it drop over here. And I inject it, and it hurt it drop over here. It might hurt it drop over there.
You're not gonna even know it.
The idea is that if I tell you that it might hurt, and it hurts, you don't get as surprised if I don't say anything. And then all of a sudden you say, oh my god.
Sore. It's cold and sore.
Yeah, it's not a big deal though.
I'm going to walk away and give it a minute for it to work, and I'll continue.
Okay. You're good. You're fine. You're fine.
How long is the surgery going to take?
12, 15, 25 hours maybe. Who knows? Oh, thank you.
Medications. So we'll see. It's they're still kind of related medications.
Oh, that's
Hopefully it'll be better
Oh, that'll
for
be,
you.
that'll
All
be
right.
fine, I'm sure.
Most
now,
people
can
don't
we,
have a lot of
now, when
pain.
do we can, I can just go.
Yeah, while she's having
Okay.
surgery.
Okay.
I wanted to see the OR room too. Guess that's not going to happen.
You will. You just won't remember it. Probably. Some people do, but
Yeah, I love you.
I love you.
I love you. More than red M&Ms.
More than red ones? What about blue ones?
Do they make blue ones?
Mm-hmm.
This is what we should take every night to fall asleep.
You think so?
I think so.
It's staying a little longer than I thought she would.
I know, me too. But she's gonna get loopy soon enough.
I am. Well,
She's already. She was sitting there going,
take it all off. Are they taking all of it off? That's raw.
Where was the worried person who was here a few minutes ago?
Yeah, I don't know. We replaced her.
I don't think this leg even hurts from the shot.
Because that's not where you got those shots.